I am now going to introduce you guys to another amazing attending of ours who is so invested in medical education for residents. I'm going to introduce you to Dr. Amish Aghera. He is our current director of simulation. He's worked at MIMO for many, many years, and he's worn many different hats. He's been a medical student clerkship director. He's been an APD here, a simulation fellowship director, and now he is our director of the entire Sim Center. He loves this program. He's invested in this program, and so I'm excited to introduce you guys to him.
All right, thanks guys. I appreciate the invite to chat about simulation. You would think that I would have practiced this many times, but I did not. I will be talking off the top of my head. It's a little bit of the antithesis of what simulation is. So I guess just a little, Sabina kind of mentioned I've been here for a while. So I started here as an attending in 2007. And I actually never thought I would be here for, going on my 14th year. I thought maybe I'd work here for a couple of years. Seemed interesting to work in a, academic program, and then maybe I'd move on. So why did I stay all this time? And I think it's really the people that I work with. I think, I'm really blessed to have a lot of wonderful colleagues. You're meeting a lot of them on this webinar today. Really amazing group of residents. I think it's very collegial. And the other thing that has kept me here for all this time, and another thing that was sort of alluded to, is all the different hats that I've worn over the years, which is, as an academic faculty member, you can do pretty much whatever you want as long as it's innovative and supportive of the residency program. And like Dr. Friedman says, if you want to do, Justin Bieber concerts versus Justin Timberlake concerts, or we can simulate another Justin in the Sim Center for you. But, it's really actually pushed the amount of innovation that you guys will see as prospective residents in this program. I really, truly believe we are far, far ahead of the curve compared to many of our colleagues. Now, that being said, yes, you will be well-trained at pretty much every program you might potentially go to, but I think there are a lot of things that are special about our program. So that being said, I'll try to just give you a quick overview of simulation here at Maimonides. I am currently the director of the center for the entire hospital. So our Sim Center is not like a room based out of the ED. It is an entire or half a floor of a building. We see 5,000 learner visits a year, of which probably a third are from just emergency medicine. The nice thing is the simulation center is primarily run through emergency medicine. So we are able to kind of give some perks to our own folks. Also, we control the budget, which means we get to buy toys that are uniquely relevant to emergency medicine docs. We have, a $200,000 ultrasound simulator. We have high fidelity transvenous pacing simulators, pretty much any piece of airway equipment you'd ever want to practice on, multiple mannequins. One of the ways we've actually been able to afford all this stuff is we've been very active in getting grants for doing innovative projects. I'd say probably since I was a division director of the ED, we've probably somewhere close to $1 million worth of grant funding. And that's where a lot of these toys come from. We have 3 faculty, other than myself, who are specifically trained in simulation. A couple of them also have active grants. One just got approved in the last month for virtual reality. So VR will be coming to a Sim Center near you if you come to Maimonides. We have another grant to 3D print airway, different airways to improve your sort of chops at intubating. So we try to do some innovative stuff. We have had a resident match into a simulation fellowship for I think 8 or 9 years in a row. We've never had a resident who is interested in pursuing a career in simulation be denied. And that includes difficult to obtain spots even out in sunny California for those who have wanted to go out west. What else can I tell you? So, from the simulation perspective, our philosophy is really to do small group learning. I think in some programs, they do simulation in really big groups, but I think that kind of defeats the purpose. We like to have you almost on a one-on-one learner to faculty type of ratio. And I think that allows you to get the most out of the experience. And the goal is to, see things that you might not see as a resident. Unfortunately, 3 years isn't a very long time. And, I think I've heard something around 15 to 30,000 patients before you've seen it all. And you're not going to get anywhere close to 15 to 30,000. That takes 7 to 10 years of practice. So we'll try to close that gap very thoughtfully. So you do a lot of cases, general medical cases, you do peds cases, you do trauma cases. I think it was mentioned we're level 1 trauma center. We actually have a ED-based trauma sim curriculum where ED residents sim together with the surgical residents as well as our ED nurses. And I think that actually kind of pays off in terms of our relationship with some of the other services, in particular surgery. I'd have to say that they're my favorite service to work with. And part of that is because we learn together. So it makes our actual experiences in the ED much easier, and we get to know each other as human beings, not just as, potential adversaries. You'll probably spend, it's not overkill the amount of simulation you'll do. You'll probably come to the sim center about 10 times a year doing various things, but it's always open. We're basically here, we serve the residents. And I guess that my one last final plug for sim is that in addition to simming with the residents, some of our residents probably don't even know this, but we do quite a bit of simulation for our ED faculty. I like to call that trickle down education. I think there's nothing more frustrating for a resident to get 5 different messages around the same clinical concept when they work with 5 different attendings. This is a way for us to kind of standardize what we do. And also it gives residents the opportunities to do things because we train all our faculty in how to do a TE or transvenous pacer or fiber optic intubation. So if the faculty is not comfortable, good luck trying to do that on shift. So we're very thoughtful about also teaching our faculty to be mindful to give the appropriate extended experiences to our residents by making them feel comfortable with doing really crazy things so they don't mind when you guys do really crazy things. And so with that, I will hand it back over to our moderators, and happy to ask or answer any questions at the end.
Dr. Aghera is awesome in championing all of these sim efforts. Sim is one of those things where I see it on my schedule. I'm like, oh, I have to go into sim today, but I always walk away saying, I'm so glad I did this. And there's this uncanny ability that the sim center has to whatever case we happen to be doing. I will see it within the next 2 weeks and be so glad we did the sim. I don't know how it happens. There's a crystal ball he's looking at. I'm not really sure. But it's because
I've missed all those cases in real life, so now they're all in, yeah.
Yeah, most of them are real life cases that have happened, and it's just a whole different experience to be able to live through it or to do at least sim through it rather than just talk about it and across the table.